I've had the fortune, or perhaps misfortune, since the places I've been working at, I usually go to after they have great upheaval. But I've had the opportunity to work in some amazing places under very extraordinary circumstances. I usually enter a scene following a disaster, which is how I went to Nagorno Karabakh. I stand in front of you to tell a totally different story. Thank you, Anna. A story built on public health research through the lens of health. But it's much more complex, much more important, because it encapsulates the importance of US presence, the realization of American ideals, and basic human rights. In the field of public health, the United Nations Universal Declaration of Human Rights, drafted in 1948, is drilled into us. Public health programming is based on that milestone document, as well as the WHO's, World Health Organization's constitution, where health is defined as a human right. The US was a key contributor to drafting that declaration. We served as chair of the committee. And we, as Americans, believe in these fundamental rights, which are and must be universally protected. With those tenets in mind, I have served on many humanitarian missions, most of which have been funded by our government through USAID. In most places, barring all the unique difficulties that come with working in natural disasters or complex emergencies, as responders, we have tried, and for the most part, succeeded in staying true to those tenets. Nagorno Karabakh is absolutely not the case. Nagorno Karabakh was and remains to be a very different environment in which to provide assistance. Generally, when we arrive at a disaster, the main responding agencies, the key players, are the United Nations. UNHCR if it's a refugee situation, UNICEF, WHO, OCHA, OCHA, which is the Office for the Coordination of Humanitarian Affairs, Red Cross, NGOs, national governments, bilaterals. The UN is usually the lead, and we break out into clusters in order to coordinate and ensure that we're meeting our intended goals. We work closely with the governments. We align programming to national standards, and we build capacity and self-reliance of local responders, government employees, everyone we're working with. That didn't happen in Karabakh. For one, there was no, and there continues to be, no UN presence in Karabakh. Can you imagine? None. No UNICEF, which is usually in charge of immunization, health education, child health, general education. No World Food Program, no food commodities, no nutrition program, no WHO, no health input. It's in their constitution that health is a human right. However, they aren't there. They haven't been there. They are not allowed to enter Nagorno Karabakh, the WHO. No UNAIDS, etc. You understand. Second, as a public health practitioner, we're used to dealing with certain constructs, ever-changing and difficult ones at times, but ones nonetheless. Here, from the beginning until now, 2 decades later, we have to implement programming for a state of ceasefire, a frozen conflict situation. The issue isn't just the definition is unclear, but more importantly, the issue is that the actions that are taken by the global community due to the lack of clarity on that state of existence is either completely lacking or inappropriate. 20 years post-conflict means you need programming appropriate to that situation. Frozen conflict elicits that the disaster is ongoing and that we aren't in a post-disaster phase. Further, as much as I'm proud of what we have done in Karabakh to date, it cannot be forgotten that we didn't provide any assistance until 4 years post-ceasefire. Can you imagine waiting 4 years before responding to Haiti? Or waiting 4 years before responding to Kosovo? I was in Macedonia accepting Kosovar Albanians as they crossed the border. So, when we think about providing assistance, we usually look at 2 indicators, need and merit. For example, as a member of the Masters of Public Health Admissions Committee at UCLA, when I'm reviewing applications to identify students that deserve scholarships, I use both indicators, right? Great need, great merit equals scholarship. Or if you're on a National Institutes of Health grant review panel, you read the proposal through that lens, need and merit. So let's apply the formula to the context of assistance to Nagorno Karabakh. When I first arrived in Karabakh shortly after ceasefire, I was the only American expat. Granted, there were only about 10 expats total. ICRC considered me high risk because I was American, but I was totally proud of that. In the region, there were no reliable health statistics. Either the statistics had not been collected or they had been destroyed from the war, and no one had any idea as to the extent of the burden of disease, mortality, morbidity that had been brought on by the war, and all of its destruction. A lot of work went into piecing together the health picture. We realized we had high rates of communicable diseases. That was not the case pre-war. Immunization programs had ceased. Water and sanitation infrastructure was destroyed. There was overcrowding in shelter situations. We saw disease rates that are not at all representative of former Soviet states. To date, some of these indicators have improved, but since there was this shift, it's called an epidemiologic shift in the entire population's disease pattern, we're still battling infectious diseases today. We also saw an increase in chronic diseases, and the difficulty became in trying to address infectious diseases and chronic diseases at the same time when our health system was completely incapacitated. The reality is also that with chronic diseases, we've seen a shift towards a younger population. That is a big issue when we're talking about growth and development of a country. Third, we saw a major increase in traumas and injuries, war-related, secondary effects of war, unfortunately landmine injuries, unexploded ordnances. Unfortunately, I saw many children killed or injured because they found a shiny toy which happened to be an unexploded ordnance. But also injuries from boiling water, scalds and burns, injuries from wood stoves that now had to be inside homes, wounds, especially those left untreated. And all of these injuries increased due to infrastructure destruction and Azerbaijani's illegal blockade. Poor water quality, no natural gas for heating. Lastly, there were limited health and medical supplies, limited pharmaceuticals, consumables, no training of personnel for a very long period of time, and lack of physicians and specialists. Again, unlike other Soviet states, Karabakh had and continues to have a deficit in physicians and specialists. So, the picture of need. It's definitely seen improvement, especially in some sectors. However, overall, there is still a great need today. So I want to step back for a moment and thank the US House Appropriations Subcommittee for its long-lasting leadership in support of its aid program. They have consistently included language in its report calling for US assistance in ANCA. We are a leading country in that respect. US support in the region is critically important. Since 1998, direct US aid to Nagorno Karabakh has allowed us to meet many pressing humanitarian needs. I was honored to receive a grant with the American Red Cross for a primary healthcare program in the first go-round of AID funding. I was also honored to receive another fund in 2003 with the American University and Johns Hopkins University as the second go-round of AID funding. But unfortunately, since then, assistance has greatly diminished. However, 20 years since ceasefire, Nagorno Karabakh is still suffering from significant infrastructure damage and poor overall health indicators. The war and its aftermath disrupted lives of individuals, families, and communities, and are depriving them from the means of growth and development. So that's need in a nutshell. Let's switch to merit. Fundamentally, we measure merit according to our ideals. First and foremost, democracy and self-reliance. Since 1991, Nagorno-Karabakh has successfully conducted 5 parliamentary and 5 presidential elections. They have been praised by international observers as free, fair, and transparent. The most recent presidential election was favorably received by more than 80 international observers from 24 countries, including ours. This generation post-war is growing up in a government of their choosing. Next, Nagorno Karabakh is committed to peace. Nagorno Karabakh has repeatedly demonstrated its commitment to a peaceful compromise resolution of the conflict. And unlike Azerbaijan, Nagorno Karabakh, along with Armenia, support the OSCE's call to pull back snipers and increase OSCE observers. We can also look at merit in process and methodology, in the utilization of the humanitarian assistance we received. In that funds, we have been efficient. Through our experiences, we have repeatedly shown time, effort, dollars. They've been well used for their intended purpose, and we have been effective. We have shown outcomes. We have shown impact. We've shown that our government's investment, although small, was a wise one by reaching our stated goals and objectives. Therefore, based on our collective shared goal of working for peace and standing up for democracy, using this formula, we know Karabakh's need is great. We know that there is great merit. Therefore, we need greater sustained assistance. First, direct US aid to Nagorno-Karabakh has represented a powerful investment in peace and an expression in support of a democratic resolution of security and status issues in Karabakh. We must expand that vital assistance program. We need to support the tremendous needs of this population that has tirelessly worked against aggression and blockade to build a strong democracy, to develop a free market economy, and to work toward a lasting peace for all in the region. We need greater assistance and sustained assistance. Second, Section 907 of the Freedom Support Act, enacted in 1992, stands as a statement of US opposition to Azerbaijan's blockade and other aggressive forces against Armenia and Karabakh. But since its enactment, Azerbaijan has not lifted the blockade and has ignored US calls to cease its destabilizing threats. Actually, the threats have become aggressive and fatal actions. Lastly, we need to end the exclusion of Nagorno-Karabakh from the peace process. We know that the best and most sustainable path to peace requires direct engagement with the people and the government of Nagorno-Karabakh, whose fate and future are the subject of these talks. They were active participants until 1998, when Baku insisted on excluding them from the peace process. As we know, government of the people, by the people, for the people. But the people are not even represented in the room. In the interest of peace and basic fairness, Nagorno-Karabakh must be a full participant in these talks. It's the only way to ensure lasting peace. In closing, in 1996, I presented my research and findings of my work in Nagorno-Karabakh to a room full of United Nations agencies. I closed that presentation almost 20 years ago with this same quote. It's by Thomas Huxley. He states, "Facts do not cease to exist just because we choose to ignore them." The fact is that the population in Nagorno-Karabakh is struggling daily for survival, and it is not being afforded the necessary assistance and support of the international community. Within this triangle of conflict, the most vulnerable group, Nagorno-Karabakh, is still marginalized and disenfranchised. And 20 years later, it is time for us to change the tide. Thank you for your time.